I'm Dr. Christian Augustin with Bayside Chiropractic and Rehab. And today I wanted to talk about a problem in the United States, and I'm going to start off with some facts. In the United States, the top 10 causes of death include, at number 1, heart disease, at number 2, cancer, at number 5, stroke, and at number 7, diabetes, type 2 diabetes. Now, my question to you is, what do these things have in common? And I'll give you a little while to think about it, and that should be long enough. All of them have a key risk factor is obesity. So obesity in the United States, out of the 10 top leading causes of death is a risk factor of at least 4 of them. Some other interesting facts about obesity is they can lead to sleep apnea. Complication could be stroke, lung disease. We already talked about heart disease. Now liver disease is another problem. Diabetes, like we've talked about it. Pancreatitis. Women's problems like painful and abnormal periods. Gallstones, and cancer, specifically breast, uterus, colon, esophageal, pancreas, kidney, and prostate. Now, close to my practice, another problem is arthritis. It's hard to see a chiropractor without some type of pain usually. And arthritis, if you're not taking care of obesity, it's very hard to help treat arthritis. We also have inflamed veins and other blood clots, and we also have gout. And all these statistics are put out by the CDC. Some other interesting facts that came out in 2010 and again in 2015 is that 1/3 of all U.S. adults are obese. And now it's become prevalent with children too, where 1 in 6 children or adolescents are obese. Now, since we live in the South, and I'm coming from Fairhope, Alabama right now, some interesting facts is that in 2015, the top states for obesity, Louisiana ranked number 1, and tied for number 2 was Mississippi and Alabama. Now you might ask, well, I'm not in an area that's really obese. Well, let's go to the top 5 cities. Number 1 was Memphis, Tennessee. Number 4 was Jackson, Mississippi. Number 5 was New Orleans. And where we live, Mobile, Alabama, was number 7 out of all the metropolitan cities in the United States with obesity. Now you might ask, what causes obesity? And a lot of people say genetics. And what the researchers have found out is that it's not really genetics. Genetics are too slow to cause obesity for the most part. And the true cause is lifestyle. So what do we look at with lifestyle? The first thing we have to look at is I don't know how, this is as blunt as you can get. We eat too much. We just eat too much. We take in too many calories. Secondly, what we eat isn't very healthy for a large part. So we don't eat enough fruits and vegetables. And the third thing is we don't do enough. We're too sedentary. We don't exercise enough. And, with the high-tech age, we work on our iPads, our computers, our smartphones, we watch TV, and we're just too sedentary. So those are the 3 things that lead to obesity. So now you're going to ask, what can we do about it? Well, at the office, I knew about 2 years ago that this was a huge problem. And you wonder why I knew? Because I, at that time, was over 240 pounds. So what I thought I'd do to help me and my patients is to bring in a weight loss program. And this is a doctor-supervised weight loss program. The name of the program is ChiroThin. And just so you can see, I have a picture of myself, which I don't know if you can see, but we can post it. Me before and me after in a 6-week period. And I was the one that always thought if you exercise more, you could lose weight. The problem with that is, usually when you exercise too much, you also grow very, very hungry. And sometimes exercise alone will not help you lose as much weight as you thought it would be. So how we look at this program is we take in consideration your entire lifestyle. And we focus initially on the first 6 weeks, which is the length of the program, where you're coming in regularly on a weekly basis to be monitored and also for guidance on the program. We look at your eating habits, and we also use some nutritional supplements. None of the supplements are drug-based. There's nothing to, like a speed, where you feel like you're being put on speed, or that you're using medications that increase your heart rate, increase your metabolism. What we use is, one thing that we use a drop, which is an amino acid drop, which has over 270 amino acids. And what they do is they regulate your hunger, and they also, through your body's systems, they also increase your metabolism, but not where you're feeling sick. Then we go through a specific eating guide. All our foods are completely store-bought. We recommend organic and non-GMO'd foods, but you don't have to. But we do put you on a fairly strict caloric intake per day. And what we've seen is that the program's very effective. I had tried to lose weight for years, could never lose over 5 pounds. And over the course of the program, 6 weeks, I lost 31. And then in turn lost more pounds afterwards. The average weight loss for a female in the 6-week program, if they follow the program, is 20 pounds, up to 25 pounds. The average weight loss for a male can range between 25 and 30 pounds. Now, it doesn't seem fair, but there are some differences between males and females, and that's, the difference in 5 pounds is just what we've seen happen. With respect to age, I haven't really seen a difference, so age doesn't really play as much of a factor as people think. Also, when it comes to if you have diabetes or you're taking medications, we'd never take you off your medications, or we'd never do anything like that. But it is safe because you are eating natural food, and there isn't any reason that you can't be on this diet for most health reasons. If we have a concern, we'll send you back to your MD and get the clearance that you can go ahead and do it. I haven't found an MD that doesn't promote this type of weight loss yet, and we've been doing it in this office for almost 1.5 years now. So what we do is you come in if you're interested, and we show a video that explains a little more about the diet, so you can make a decision on whether you want to do it or not. Now, we want people that really want to lose weight and really want to get healthier. So it's no obligation to come in and watch the video. And if you decide not to do it, that's fine. Now, what I am offering, if you're watching this video, if you mention the video and you share and like the video, and also like our page, then I'll offer $75 off the entire program for those people. If you have any questions, don't hesitate to call the office. The number is area code 251-990-8388. And again, my name is Dr. Christian Augustin. Be happy and healthy, and I hope to hear from you soon. and I'm with Bayside Chiropractic Rehab and Laser Therapy. Thank you.